Hi everybody, I am Dr. Archana. Along with Dr. Nasreen, we started EVA IVF and Women's Center placed at Chennai, India. We are the co-founders and director of the same. All throughout the years, we have seen countless number of couples having so many challenges to achieve parenthood. We have touched the lives of many such infertile couples, help their achieve the dream of becoming parents.
There are a lot of misconceptions about fertility issues everywhere. Globally, the fertility rates are decreasing. It is our responsibility to give clear information to right people at the right time. EVA IVF and Women's Center Chennai, along with the Naruna Healthcare, is is organizing this series of podcasts on various fertility issues. Let us start out with the basics.
Uh, over um Over the years of fertility practice, I have seen tremendous improvement how the couple perceive infertility as. See, for example, 20 years back, only the wife comes along with their near relatives. We never see the husbands. But then now, actually, the couple come as a couple. It's
Hmm.
very beautiful to see them, and they accept the problems, they accept the treatment. So I feel that now the awareness about the fertility and the science behind it, many of the couples are aware of it.
As you rightly said, Dr. Archana, there is a huge improvement in the awareness part from the couples. There is also improvement from the family. As a society, also, there's a lot of improvement. The family perceives the fertility issue that the couple should go to the doctor and get right treatment and right time, and they should start the family at right time. Because in only in 30% of the cases, the fertility is contributed by women alone. In another 30% of cases, it will be co contributed by men and women. Whereas men is the sole reason for fertility in up to 40% of the cases. Over the almost 15 years of our fertility practice, we have seen there is a lot of increase in male infertility cases, especially because of the environmental factors, lifestyle or stress or whatever it is contributed by. There has been definite increase in male fertility, so the couple has to come together and start their
Certainly.
fertility treatment.
Yeah. And through these years, there is a tremendous awareness about the biological clock. In our practice, we are actually seeing females, unmarried girls who are yet to get married. They want to postpone their pregnancy for many reasons, be it social reasons, economical reasons, or any other reason. They want to postpone their childbirth for their education. So many reasons are there. Uh, uh, so they come to the hospital, they get their ovarian reserve tested. They ask for the ovarian reserve. Doctor, what is my reserve? Test it and show me. And accordingly, they plan their childbirth, and the awareness is there. So everybody talks about the biological clock and the ultrasound, the AMH, and we are surprised to see that patients themselves come forward and ask for these tests. Before some 20 years, 15 or 20 years back, we spend a lot of our time educating the patients about that. Please get married soon. If you are not getting married, please plan your childbirth. But now the fertility awareness is so much that the females are coming forward knowing their biological clock is ticking, and they plan their career and their birth perspectives accordingly.
Women, as they get more awareness, they come and get tested in the even before marriage. They come and get tested. When we talk about the biological clock, nature gives little disadvantage to
Yeah,
women.
true.
Yeah,
Yeah,
women are
that is.
a girl child is born with fixed number of eggs at birth, whereas a male child, when he becomes a man, he produces sperm and he will continue to produce sperm even up to 50, 60 years. Only the quality may come down, but the sperm production continues. Whereas for a woman, as the puberty, once she attains the puberty age, every month the available eggs are getting used up. So month on month, as she menstruates, more and more egg number falls, and this process gets accelerated after 30 years of age. So that is the reason we advise women, especially when they cross 30 years, they should get their ovarian reserve tested. This can be done with a simple blood test, as you said. with the anti-Mullerian hormone
Yes.
or also with ultrasound.
Yes.
There is also the negative side of the point that as the society gets more awareness, they get more misinformation about the fertility issues also.
Yes.
So they think that they will
Women.
continue to be fertile even after 35, but that is not the case.
It's not only the females, men also come forward before marriage, or simply they just want to get tested themselves, just like we have screening for other, for heart diseases, or for liver disease, and we have screening tests. Men come forward to test their fertility. That is a very very good sign that they want to be perfect before marriage.
Yeah, the other point of the other aspect of the story is that in the current generation only we are seeing that
Excessive.
older mothers and older fathers, the age of the first time father or the first time mother is above 45 is more when compared to the previous generations. So there is a basically need for them to get tested because they are postponing their families.
Yes, even though there is a lot of awareness about fertility, there are still a lot of misconception too, which is going around. Like for example, we talk about biological clock in the case of females, but in the case of men also, even though they remain fertile till the age of 60-65, the ability to man a child actually reduces after the age of 40, because the sperm parameters, there is a age related reduction happens after the age of 40. And especially during the present era, where the occupational thing also comes into play. Like for example, there is a lot of erratic night duties happening. In previous generation, only particular occupation like a policeman or doctors, they do night duties. We are seeing that now. The night life of public has increased like anything, and plus the lifestyle factors also.
Yeah, yeah. As you rightly said, our body has been designed in a way that we work during the daytime and we have to rest during the night, because our body produces more insulin in the daytime, and as the sunset happens, body's reparative mechanisms has to happen. So the melatonin comes into play. So all the repair processes has to take place. But when we see nowadays the nightlife has become a norm, there is a shift in this, and there is a shift in the biological clock. So the circadian rhythm is altered. So be it men or women, their fertility definitely comes down, especially when it is happening in the erratic way. So for example, some profession like medical profession or policemen, they have to work in the night. So
Yes.
if that is the need, they have to fix their schedules. The next most common misconception which I come across in my practice is women coming and telling me that they have been trying only during ovulation time.
Mm.
So, as a fertility practitioner, I would generally advise the couple to try at least once in 2 to 3 days, so that they will have a regular rhythm of functioning of the reproductive hormones. Especially once they try only during ovulation time, they get more stressed. Instead of it being a pleasurable activity, it becomes a targeted activity. So they get
Mm.
more stress.
Mm.
Men get erectile dysfunction, women get vaginal dryness and irritation. So ultimately when they don't get result, they come and tell me that I tried punctually during the ovulation time, which is not correct.
Yeah.
So they have to try throughout the month, but those pregnancy can happen only during ovulation. So
Mm.
to make that happen, to increase the success rates, they have to try throughout the month. So what is
Yes.
your experience?
Yeah,
Mm.
it's actually, it should not be taken as a, we are writing an exam and waiting for a result. We have seen so many couples doing this mistake. Couples will be the husband and wife staying in a different parts of the country, different parts of the world. Even sometimes they come and meet only on the ovulation day. It's actually very very, it's a very bad thing to do, because as you said, it is a natural event. It's a natural event. We should not convert it into a event where we expect the results and do. If
Yeah,
we
yeah.
expect the results and do and make the event into a, like a task, that becomes a problem.
Yeah,
That
especially
becomes a problem.
a task with a fixed target.
Yeah,
Mm.
task with a fixed target.
Mm.
So we generally, I advise a couple never to do that, to try naturally, weekly 3 times, and don't track ovulation. Of course, especially in the past 10 years, there are a lot of advancement and lot of what to say, over the counter pharmacy kits like LH kits and all going on, where they test the kits. Actually, LH kits is not that much reliable in our practice, but using that kit itself will make it more stressful for the couple,
Yeah, they will become more conscious about the
conscious about
process.
it. So we generally avoid, tell the patient to avoid, tell the couples to avoid such encounters.
Yeah, we advise a couple to try regularly if they have regular cycles. Even if they have irregular cycles, they have to come for ultrasound and get their
Yes.
ovulation. Ovulation tracking can be done with ultrasound. Yeah.
There are one more common practice, one more common misconception which I encounter in my practice is, when the couple becomes, when they age after 35, they are certain groups, certain cohort of couples, they'll like fix themselves that they'll never conceive. It is not like that. It is only your the percentage of the couple who conceive will become less. It's only like that. It doesn't mean that they cannot conceive naturally. Only if you're already been diagnosed with a low AMH or poor ovarian reserve, or if there is any problem in the husband's sperm count, there is a possibility that you might need a higher treatment. Otherwise, depending upon just taking age as a sole criteria will never advise a couple to go for a very costly or a higher treatment. There is a lot and lot of other factors which is involved in that.
So we have to educate the couple about the maximum possibility they can have in a cycle. So what we call as
Mm. Secondary.
cycle fecundity rate. So it is maximum 20 to 25%. If a
Exactly.
couple has everything normal, also only 1 in 10 couple will conceive in that particular month, and the rest of the 9 has to go for the next month and they have to try. So they should not lose hope that they don't conceive in the same cycle itself. So it gives lot of stress, and they get misguided by their family members also. It's not wrong.
Exactly.
The other misconception among public is only couple with advanced age they should go and get the fertility treatment by a fertility consultant. That is not the case. If a woman is getting married above 30 years, they should not wait for the complete definition of the fertility treatment. That is, we generally define fertility as inability to conceive after 1 year of unprotected intercourse. But if a couple is already married late, or they have some background issues, like they have irregular cycles, or the semen parameters are subnormal, or they have some diagnosed conditions like endometriosis, ovarian cyst, or fibroid, they should not wait for the 1 year to complete and then they go to a doctor and get treated. So as soon as the diagnosis is made, they have to seek treatment. So that improves their prospects.
Yes, and during my practice, many patients actually the number of patients coming for fertility has actually increased, but they are very afraid to come inside, the fertility centers, because they are afraid, because they are thinking that we are going to offer treatments which was very high grade or advanced treatment even for simple issue. It is not like that at all. There are a lot of factors is involved, as I said. We'll be analyzing them, investigating them, and if there is even a single possibility for them to conceive naturally, we are going to try that. We will try that wholeheartedly, because it is easier for us also as
Yeah, that
doctors.
naturally increases our success rates
Yeah, it
also.
naturally increases our success rate also.
Mhm.
So I just want to tell to the public that fertility center, if it is IVF, the doctor is not going to jump in and ask you to do for an IVF. IVF is a very huge big process.
Yeah, there should not be any misconception about the
Mm.
public. Once they visit a IVF center or a fertility center, we will offer only IVF. That is not the case. Even if everything is normal, we can advise them to go for a naturally assisted fertility treatment. That we will supervise them whether their ovulation is happening normally. We will give them an education that this is the possible ovulation time, especially if their cycles are irregular.
There are a lot of interesting movies out there where they show the mixing of the sperms, the eggs, taking eggs out, they're transporting eggs through the planes, and people think that that is all true, which is actually not possible at all. We have very strict ART rules in India. And there is no mixing of gametes at all. That we have, if the patient wants their own eggs, own sperms, we are going to use only that. If their condition warrants not to use your sperms or not to use their eggs, we'll clearly explain them their possibility of the success having their own eggs and own sperms. Only with their consent, we take, after taking the consent, we take the eggs from another person, or the sperm from the another person, and we transfer the donor gametes. So it is a very common misconception that when a patient comes into a fertility center, there is a mixing of the gametes take place. It is legally not possible, and none of the fertility centers will can actually do, because the donor gametes, that is the donor sperms or donor eggs, coming from the ART banks, which is an entirely different entity. For example, if a patient comes to me and asks for a donor egg, I won't be having any donor egg. I have to get from the ART bank, which is a government approved ART bank. So everything is legalized, everything is in white papers. So the couple coming to fertility center, or any fertility center for that matter, need not worry about the about that issue.
Yeah, exactly. So every medical practitioner and the ART centers are also they are bound by laws.
Yes,
Yeah,
exactly.
with the recent ART law, as you
Mhm.
said, so we have to get consent for everything. Even
Mhm.
sometimes we make sure that we get audio-visual consents also to help in the
Mhm.
process.
Mm. Through all our concerns, or for all the patients, we get the audio visual concerns. That is, we take the audio as well as a video of the patient, consenting them for whatever procedures we are doing to the patient.
When we are talking about that, I just recollect an experience of a man with a zero sperm count, that is azoospermia. So they have been told everywhere else that he can become a parent only with a donor sperm, but we could retrieve some viable sperms from his testes, and today he is the biological father of his own child. So with the advent of medical technologies, everything is possible. They need not directly go to
Go.
the third party reproductions.
Mm. So, as a fertility specialist, the main problems, the main challenge we face every day is to give the right treatment to the right couple at the right time. Because the clinical conditions might be same for the different couples, but taking into account their social reasons, the economical, the psychological, and how they are placing themselves in their life, everything has to be taken into consideration, and then we offer a treatment. So, mostly to our patients, when we actually ask them to step into the fertility center when they are more than 35 years, when they are aging, when they are more than 35 years, if the female has irregular periods, or if they do not have, or they rarely have intercourse, if the men have any problem in ejaculation, or if there is any previous surgeries done in the past, or generally any medical illnesses like diabetes or hypertension happening in the couple, or if they are trying naturally without any problem, they are taking time like more than 2 years, you are not conceiving, they should definitely step into the fertility center.
Yeah. As you rightly said, once they step into our center, it is our responsibility to guide them
Yes.
appropriately. So, depending on their clinical situations, somebody may be very young, but they would have been married for a very long time. Somebody is getting married at 20 years and trying for 8 years is different from somebody who is married only at 35 years and trying for a baby. Once they approach us, so we need to do a basic evaluation. So, we will do an ultrasound scan for the women. We look into her uterus, so whether it is of normal size, whether her endometrial lining is normal, whether she has any blocked tubes, her egg quality is good, how is her ovarian reserve, all these things we will assess. And also we will see the men for his semen quality. So there are basic three parameters we see: the count, motility, and the morphology. And also we need to tailor the treatment for the couple based on their other blood tests, like whether they have abnormal thyroid parameters, whether sugars are in borderline range, or whether they have prolactin issues. Based on all of these, we have to tailor the treatment and give to the couple.
Yeah, true. So when a couple step into a fertility center, as you said, we'll advise them a few tests. Only certain couple will actually require a battery of test. Battery
Yeah.
word English correct. Certain couple they require only few tests, as you said. So depending upon the test results, we categorize in our fertility center whether they need simple treatment or a more complex treatment, whether they need a natural treatment or they need a more complex treatment. So we categorize them for a natural treatment. And then just for follicular study, we do follicular study as well as ovulation induction for some couples. Some couples we try ovulation induction with just medication. With for some couples we try with injections. Only when all these treatments are not working for them, we go for the next level. Whatever we have discussed right now, these four types of treatment, they're all simple treatment where we just assist the women to ovulate naturally and try make them try naturally.
Yeah, as you rightly said, there is a difference between the couple trying naturally by themselves and seeking a fertility help. Once they come to us, we have to make sure that all the things are normal with them, and then we have to advise them to go for normal trying. Once we find any abnormalities like any blocked tubes or any cement problems, or some fibroids or cyst in the some fibroids in the uterus or cyst in the ovary, so we advise them to go for sometimes for surgical correction.
When we start any treatment for a couple, whether it is a natural treatment or a simple treatment or a complicated treatment, whatever treatment, the first thing the patient asks to us is what is the success rate,
Whether I will
whether
get 100%
yeah
success rate.
100% success rate or not. It is the most common question. We want to we want them to have 100% success rate, and they want themselves to have 100% success rate, but science doesn't approve to that, right? So in natural treatment we have something called as the fecundability of a couple. We human beings are very very poor in reproduction. We are not like dogs, cats or mosquitoes. So our cycle fecundability, that is in a cycle, a man and a woman, if they are going to be together, only 10 percentage of them, that is only 1 in 10, will actually conceive naturally. If they are going to go for a higher treatment, like for example an ovulation induction treatment, where we just help the couple, we just help the women to ovulate, that is we just help the women to just make her egg grow. In such cases the fertility rate will increase to just 5%, probably till 15 percentage. If she's going for a very high treatment like an IVF treatment, it is not going to be 100% at all. The clinical pregnancy rate in the present statistics is only about 30 to 40 percentage. See, the clinical pregnancy rate is only about the 30 to 40 percentage, even the couple is going for an advanced treatment.
Yeah, the reason for their fertility problem decides the success rate. Actually, if someone comes to us with blocked tubes and we do IVF for it, the success may be close to 100%. But it will not be the same with a severe sperm problem or very low egg quality. So we always tell the couple that they will have a couple specific success rate.
Exactly. It depends
Yeah,
upon the condition of the couple.
yeah.
The success rate.
Even if we do
The pregnancy rate.
IVF, what are we going to do with IVF? We have to prepare an embryo, that is a baby. The baby will be prepared from the egg and the sperm only. Once their egg and sperm quality are reasonably okay, then they will have good embryo quality. Again, we have to place the embryo inside the uterus. So once their endometrial lining is good, then they will have very good success rate. If they have some limitations like thin endometrial lining or poor egg quality, we will advise them some adjuvant treatment to improve their quality, and then we will take them up for the treatment.
But in very very rare scenarios where the success rate will be very poor, we have seen couples where even though the success rate is poor, they take the treatment because they want to try. Most of the couple, they won't be willing for the donor programs at all, because it is a natural instinct of any person, any couple, to have their own child. That is a natural instinct. So even though the sperm quality might be very less or the egg quality might be very less, we advise them to go for a donor, because in India it is not Sponsored.
Mm.
So in India, it is not sponsored. For
Mm.
example, if you go for certain abroad countries, actually they sponsor the IVF programs. Here it is not. It's a patient's hard-earned money. That too for low socioeconomic population, we actually find it very very difficult to convince them for donor programs because it is actually cost effective and it ensures a better clinical pregnancy rate. But in spite of that, they may not be in a position to accept that. For that, we have devised so many advanced treatment protocols, and we have ensured that the in that particular cycle the patient get the best possible quality egg, and even one quality egg is enough to make a good quality embryo so that we can make her pregnant.
Yeah, yeah. So the right to reproduce or the right to father or mother the own biological child is, as you rightly said, it is anyone's birthright.
Yes.
So they will long for that. But it is our responsibility to educate them that their egg quality or the sperm quality may not be as good as someone who is having a very ideal quality. But nowadays we have a lot of self embryo programs where we give, even if a couple is having only one egg or two egg in the ovary, we give them what we call as multi-cycle IVF. We do mild stimulation programs and we retrieve the eggs and we pool them and then transfer that one good embryo to get that one good successful pregnancy outcome.
Yeah, there are a lot of treatment options available, advanced treatment option available, where we can do stem cell therapy, where we take the stem cell from the patient's blood, we process and we put it inside the ovaries, where the stem cell inside the ovaries produce the egg cells. Similarly, the stem cells we process and inject into the testes of the male, so that the new sperm cells are produced. So like this, there are a lot of newer advanced technologies are available, so that we give the best to the couple. If the patient is willing to go for all these options, there are technologies available to make sure that they can further their uh, child with the own gametes. In the past few years, there is tremendous improvement in the way a fertile couple has been evaluated, treated, and all. So previously, IVF means only injections. I have seen a poster where a woman will be surrounded with lots of injections. That was a beautiful poster where it has been calculated that throughout the IVF journey, a woman uses nearly 1,000 syringes. But now the technology has improved in such a way that the injections are long acting, so we use minimal IVF stimulation, something called as a green IVF stimulation, where we give very minimal drugs to the very minimal medicines to the patients, where once in 3 days or once in 2 days they receive injections. So it is a very beautiful technology, especially for working professionals, especially for those who is afraid of injection. This minimal stimulation and green IVF is a boon for them.
Yeah, the another improvement in IVF technology is time lapse imaging. We get to know the real time development of the embryos, the rate at which the cells develop, which embryo goes faster, which embryo grows slower, and which compensates better. All these time lapse images we get, and we are able to choose the best embryo to transfer to the couple to get the best success rate.
True, in time lapse imaging, we can actually visualize. It's a beautiful technology. We can visualize how the embryos are growing in real time. So previously, some 15-20 years back, if we get six embryos, we'll be confused like which one to choose and transfer into the uterus. But then, because of this time lapse imaging technology, we can see out of six which one is coming first, which two is coming first in growth wise. So we select those embryos and we put it inside the uterus, so we ensure the success rate in the very first cycle itself.
Yeah, and the another improvement is IMSI, that is intracytoplasmic injection of sperms with morphologically selected sperms. With the advent of high definition microscopes, we are able to select the best sperms with the best morphology and we inject them into the eggs to get the good embryos. The another improvement in IVF technology is cryopreservation. The cryobiology has evolved so much so that the couple can preserve their embryos for years together, even up to 10-15 years. So there has been instances in our history that we were able to give two embryo transfers, two pregnancies with one egg pickup.
Yes, yeah. Very important advancement is which embryos to select. As we already discussed, the time lapse imaging. There is another technology where we test the embryos directly. Previously, we used to chuck out a part of the embryo and we send it for a genetic testing. It
Which
may
is
not
called
be,
PGT.
yeah, which is called as PGT.
Mm.
So now we have something called as NIPGT, where we need not take out a part of the embryo, instead of which we send the media under which the embryo is growing. It will uh, it will make us to understand better about the embryo, so that we transfer the embryo which is genetically normal. It's not only the morphology. It doesn't mean that if a embryo is looking good, the genetic wise it will be good. So genetic testing is possible in a easier way in present scenarios.
Yeah, exactly. As you said, in non invasive PGT, we take only the fluid in which the embryo is growing. From that fluid, we can get a lot of information about the embryo, and we are able to give better success rates to the couple by transferring only the embryos with good quality. The another advent is the couple with any genetic diseases or previous abnormal babies. If they have been diagnosed with any genetic diseases, from this fluid itself, we can diagnose the condition or any medical condition the embryo is to have, that is the baby is going to develop in future. So we can avoid those embryos and transfer only the embryos without any diagnosed diseases.
So as in previous days, where in previous years, where if the patient, as you said, in couple, if they had repeated miscarriages, or they had prolonged infertility, or they had any genetic disease, directly we didn't have any other option than suggesting them a donor. But then right now, in present scenario, utilizing their own eggs and their own sperms, we are able to genetically select the proper embryos and we are able to transfer it, so it ensures a better success rate.
The other improvement in fertility treatment is cancer treatment, that is fertility preservation in cancer patients. With we have lot of advanced cryobiology options. So even adolescent boy, that is a teenage boy who is diagnosed with a cancer, can freeze his sperm and father his child in later ages. Also, a woman, if she is diagnosed with any cancers of the reproductive tract or anywhere in the body, and she needs to go to chemotherapy or radiotherapy, there is a high chances that all her eggs will be depleted. So with the IVF, we can take out the eggs, we can store them for years together, and once she's cured of the disease, we can use them to form embryos and make her a mother.
Yeah, it is not only for the cancer therapy. There are a lot of other conditions, non-cancerous conditions, where we give metabolically active components, especially in the case of rheumatoid arthritis, in the case of multiple sclerosis, where the rheumatologist,
Cytotoxic before taking.
where
Mm.
for other conditions,
Mm.
we prescribe cytotoxic medications during the childhood. When that child grows into an adult, we see that in the case of females, they end up having poor ovarian reserve. They end up having premature menopause. In the case of men, they end up having poor sperm count. In such cases, the awareness is also important. When they start the medications, high dose medications, we have a lot of technology to preserve the eggs or the sperms when the quality is good.
Yeah, exactly. The other aspect of the freezing is social egg freezing. That is a
Mm.
game changer in many women's life.
Mm,
We would have heard about many celebrities like Priyanka Chopra. She has frozen her eggs before her 30s, and by the time she found her right partner, maybe around 40 years, she was able to use her own eggs to become a mother at that age. So, social egg freezing is a game changer nowadays.
Yes, yes. Social
Mm.
freezing is definitely a game changer. But what in media we are seeing is only the success stories. It
Mm.
doesn't mean that if I store my eggs, it is not like I store my money in my bank and after some 10 years I go and retrieve the money. It is not like that at all.
It is a biological product,
It
so
is a biological product. So I'm going to freeze my eggs. The cell, the egg is a cell, and it is going to undergo a process. So after 10 years, when we retrieve the eggs, no one should ensure you, we cannot ensure you that the same quality will be retrieved. So we should understand the fact that even though we ask the patient to freeze their eggs for any reason, for that matter, it can be social or medical reasons, for that matter, we cannot ensure 100% clinical pregnancy rate. That is very important knowledge the public should have.
yeah, when you talk about for social egg freezing, I recollect one of my patient's experience. She's already 35 and she's having only very few eggs, and she's coming and asking me to do the social egg freezing, which is not practical because the retrieval rate of the eggs depend on the age at which we freeze the eggs. So if someone is thinking about a social egg freezing, if someone is in career at a crossroads with their career and biological clock, so they have to choose at right time. They should not miss the bus and then come to me, then they come to us at a 35 or 40 because it is already late.
Even though there is a lot of awareness, and both men and women know about their fertility health, they know what to do. But realistically, it is not possible for many couples to step into the fertility treatment. I feel that in the previous generation, women mostly they were homemakers. And now we are all empowered. We are empowered socially, economically. We are all equal to the men, and there is no doubt about that. But there is a slight downside for that, because we are seeing couples where their timings don't match. They are not even seeing each other most of the time. But at the same time, we cannot ask, after so many education, after so many, it's like adding the feather to the cap. We have seen so many female professionals coming up. We cannot ask them to quit their job and stay at home and wait for their husband. It's not possible at all. So the main challenge as a fertility specialist is that when we advise a couple to be together, even though they want to be together, at the same time they are not actually able to be together because of the difference in their timings. So what we suggest is, don't quit your job, or don't change your job because of that. Ask your other employees to help you. Open up. There is nothing wrong in opening up, because everybody is talking about it in social media, and everybody knows about it. So talk to your employees, talk to your staff, talk to your higher professional that you are in this treatment, and you are really trying for a baby, and so in such cases, I think the help will actually find you.
So even though women are educated, there is still a conception that the fertility is a stigma topic. So,
Hmm.
as you said, many women are not willing to open up about their fertility treatments in their workplace. So they are not willing to get their support of their
Exactly.
colleagues or the
Mm-hmm.
superiors.
Mm-hmm.
So they squeeze themselves to make the best of both worlds. So I have an experience of a working woman who used to come to our clinic at 8 o'clock in the morning to get her shots, and then she goes to the work. So the other challenge is, when compared to the previous generations, the mental maturity and the maturity of the couples and their understanding is less, I feel, because they are in nuclear families. They don't get the support of their extended family.
Mm-hmm.
So the parents are not with them, so they have to manage everything by themselves. When we talk about this stress of fertility issues, especially I feel women feel more stressed about the fertility treatments because they feel there is a pressure put on them, especially
Exactly.
from the in-laws side. The mother-in-law keeps asking the daughter-in-law every time, "Oh, you got your cycle this time? No good news this time." So this puts a lot of stress on the women, especially when they are in treatment cycles. So a women has to practice mindfulness. So they have to think from the practical aspects, and they need not satisfy everyone in the family. And getting a child is only a part of their life.
Mm.
Whether or not someone is going to have a child, they have to be happy to lead their own life. Even I have come across couples coming and telling to me that they had suicidal thoughts because they had fertility issues. I counsel them that it is only a chapter in their life, as you rightly said.
Yes, yes.
Mm.
So, when a couple comes to me and says that their near family members are constantly asking, I generally tell them not to worry about it, because it is a common human tendency that people around us will start asking for things which we are not actually having. It is a common psychological thing. For example, if you are not going to have a, if you are not having a kid, people ask you when you are not having a kid, when you're going to have a kid. When you have a kid, they'll ask you when the kid is going to go to the school. When the kid goes to the school, they'll again ask you when the kid is going to go to the college. So you will be bombarded with questions, no matter whether you're going to become parents or not. If you're going to become parents, next set of questions will come into your life. So be prepared for the next set of questions right now. Like that, I actually counsel the patients.
Yeah, yeah. As you rightly said, choosing to ignore that quality we should develop, and we should not be thinking that I should be satisfying everyone at all points of life. Yeah, I had to treat a couple. The woman's age was 43 and the husband's age was 47, and they wanted to father or mother their own genetic child only. I counseled them all the possibilities, the success rates. They told me that even though it is going to be only 10%, they wanted to take the chance. And they were one such couple who had like positive outlook on everything. So, to my surprise, she got pregnant with her own eggs at the age of 43.
Hmm.
Mm.
So we had a couple. We had a couple who had a very grave history. Like throughout her journey, she has been married for nearly 15 years. For the past 15 years, she would have gone to nearly 15 different hospitals for nearly 15 different reasons. Either for irregular cycles, she had poor ovarian reserve, very less egg count, and her husband had very less sperms. She had multiple fibroids inside her uterus. Her endometrium was not growing properly. Plus, she had many medical conditions like diabetes, hypertension. So, when I looked into the file, first I thought like the sister is bringing me files of four different patients. It was so thick. The first time when I went through the history, it took me nearly 45 minutes. When I looked at her eyes, I could feel all the pain in her life. She was with so much hope and she came to us. Then we examined her, and it was unexplained at that reason, because all her fibroids were cleared by previous doctors. In spite of that, she was not able to conceive, and probably because of her poor egg count. So with advanced protocols and tailor-made protocols for her, we were able to retrieve one egg. Even at that time, I told her, like, since she had multiple failures, kindly go for a donor program. But then she was not consenting it for it at all. So we all pray to God that that egg should make her mother. So that egg was a very good quality egg by God's grace, and we injected one single sperm, and we got one beautiful embryo which we transferred, and she got conceived. And in fact, she went home with a baby at 36 weeks.
That was very inspiring.
Mm.
So, I recollect a patient's history.
Mm.
The couple are from very rural
Mm.
area. They
Mm.
had lost all their three children to tsunami, and
Mm.
they had their family planning surgery done after the third child was born. Now that her tubes are tied and she has lost all her children, and her age was also above 30. So we advised her to go for IVF, and she got a twin conception at the first attempt itself. So they felt like they have their older children were reborn to them as these twin babies. So that was a very
Touching.
satisfying part of our story.
So there are numerous couples whom we have helped. We have quoted only a few. There are, if we start telling the success stories, probably we'll take a day. What I want to convey is, there are a lot of treatment options. There are advanced technology. The science will make anything possible. That is the thing. The science can make anything possible.
The art and science of fertility is ever growing. So we have reached a stage where there's not even a single condition where we cannot help the couple to have their child. So it is up to the couple to open up, to seek proper guidance and become parents as soon as possible.